CheckMate-649 is a pivotal global study to establish Nivolumab plus chemotherapy as a standard first line for first-line gastric cancer population. And the interim analysis, which was published in the Lancet last year, showed a significant improvement of the PFS and the OS in CPS 5 or higher population, as well as a benefit in overall patient population. And now this treatment is approved in several countries, including the US and Japan. And we also recently reported updated survival result in Nature, which show long-term survival benefit of nivo-chemo combination and enrichment of survival benefit according to CPS status. So in this biomarker analysis, tumor mutation burden, or TMB, defined as a total number of somatic missense mutation, was assessed by whole-exome sequence of baseline tumor tissues. And here TMB was defined as more than 199 mutation per exome based on previous experience in other tumor types. Also, gene expression signature was analyzed by RNA sequencing using baseline tumor tissue. And this signature included inflammatory signature, stoma-related signature, and angiogenesis-related signatures. As a result, nearly 1,600 patients were randomized for nivo-chemo versus chemotherapy, and nearly 40% of patients had a variable TMB result, and around half of patients had a variable gene expression result. First, looking at the TMB result, overall survival benefit of nivo-chemo was observed regardless of TMB status, but benefit was somehow enriched in TMB-high population, which was around 8% of overall patients with a hazard ratio of 0.48. And the results were consistent when patients with MSI-high status were excluded. But only 4% of patients had high TMB-high and MSS status. And then we stratified patients by both CPS and TMB, and TMB-high was associated with a relatively small hazard ratio regardless of CPS status. In patients with CPS 5 or higher status, hazard ratio was 0.75, even in TMB low patients. In contrast, CPS less than 5 and non-TMB high patients showed no or very small benefit of nivo with a hazard ratio of 1.0. Also, overall survival favored nivo-chemo in most subgroups according to stroma-related and angiogenesis-related subgroups, but lower stroma-related and angiogenesis signatures appeared to be associated with a large benefit of nivolumab, and higher signature showed relatively small benefit regardless of PDL and CPS status. So lower stroma-related and angiogenesis appeared to be associated with a larger nivo benefit, even in CPS less than 5 patients, and a higher stroma-related or angiogenesis signature suggested no benefit of the nivo. So in summary, overall survival benefit with nivo-chemo was observed regardless of TMB status, although the magnitude of the benefit is somehow enriched in the small number of patients with TMB-high tumors. And the lower stroma-related and angiogenesis signature appeared to be associated with a larger nivo benefit, and a higher signature suggested to a small or no benefit of the nivo. But the clinical utility of this biomarker in this exploratory analysis will need to be further validated in future prospective studies.